Good July, Monday and Tuesday around the world, weightlifting world. We are counting down to start the IWF Coaching and Research Committee webinar, the summer series, our second one. We had one available already in June, and if you missed that, you can watch it on the IWF YouTube channel. Also, we will be having one more webinar later on after the summer, after the Olympic Games, and that will be in September. We have about 2 more minutes left. And today, for those of you who read the invitation clearly, I hope you have watched the Game Changers. Here in Europe, it's available in Netflix. And so that you have some background information to one of the presentations. Today, we will have 3 doctors presenting, a trio of doctors. This is exciting. And as we are setting up here, we're going to the last minute. And we will then first have presentations of who are here. And then after that, we go with our presentations, 3 of them. And between each presentation, there will be a 1-minute clock ticking down. So if you need to run to the kitchen and get something to eat or drink, it is possible. You won't miss anything. So pretty soon, we will start with a welcome for everyone. Hello, everyone. Hello, weightlifting world. It is Monday and Tuesday somewhere in the world. And my name is Carolina Lundahl. I am the Deputy Chair of the International Weightlifting Federation Coaching and Research Committee. And I would like to welcome everyone to our second webinar of the summer. And I would also like to welcome the IWF Interim President, Dr. Michael Irani, to give us the welcome for our webinar. Please, Dr. Mike.
Thank you very much indeed, Carolina. Carolina, I'm very pleased. In fact, I'm delighted to have been invited to present, but also to give this introductory talk. Your work is exemplary, you're industrious, and I don't know how you manage to work as a teacher, look after your family, and do this weightlifting job as well. But it's marvelous that you do. You're an example to us all. Thank you very much. What we're going to talk about are topical points, things that we know about, sort of, but not exactly. So all the subjects you'll hear are research subjects, or in my case, more like standard practice that we need to observe. I hope you enjoy it. I hope you preserve what you learn, and I hope you never have to practice what I'm going to teach you. So bless you, Carolina. Bless you all for tuning in, and thank you, our speakers. Thank you, Carolina. God bless you as well.
Thank you, Dr. Mike. Yes, we will have a very nice European evening here, daytime in Pan America.
Japanese. He's Japanese.
Yes, and a Tuesday morning in Asia. Yes. Who we have here now? We have I will first go through the background and then we'll go through the presenters. We have our IWF Secretariat, We have our IT manager, tech support from Finland, Jarno Tiainen, and Mr. Zoltan Veres from sitting in Budapest. And our presenters, we have already heard from Dr. Michael Irani, and after him, we will have Dr. Junichi Okada, and after him, we will have Dr. Kyle Pierce. We will do about 1.5 to 2 hour set tonight. And for the Zoom listeners, there's a Q&A tab, and you may leave questions there. We don't have a chat function. The moderators will review incoming questions, that is myself. And if there's a lot of them, we'll see how many we have time to go through. And if there isn't that many, we might be able to answer them today. Also, if you want the PowerPoint presentation, we would like for you to contact us for that, because it will be available on the YouTube channel for your viewing. And everyone who is watching will be muted throughout the webinar. So let's go to our first presentation. Our first presenter, IWF Interim President, Dr. Michael Irani, joins us from London. Lately, we have, of course, seen Dr. Irani leading our federation, but as we all know, he has been active as a medical doctor at the highest level in weightlifting, including the Olympics, World Championships, and the Commonwealth Championships. At the beginning of the COVID pandemic, he also lectured on taking COVID into consideration in training and competitions, and you can watch this presentation also on our YouTube channel. Dr. Irani is a staff member at Princess Margaret Hospital in Windsor, England, and he has a private medical practice. So ladies and gentlemen, Dr. Michael Irani will give the coaches advice on what to do when an accident occurs in training. Thank you.
Thank you very much. As I said, I'm delighted to be here, and thank you for having invited me. The talk that I'm going to give is what to do in an extreme emergency. Can we have the first slide, please? Thank you. People ask me what my degrees are, so the next slide shows that in Britain we have Bachelor of Science in Physiology, Fellow of the Royal College of Physicians and of Surgeons, Institute of Sports Medicine, and I'm a Fellow of the Faculty of Sport and Exercise Medicine. So I have a good, strong founding in practice of medicine and surgery, but also applied to sports. So let me start talking now about the subject. Please, next slide. These are common injuries in training. These are training injuries that you think, oh, well, it's just a twinge or it's just a shoulder sprain or some such. But there are things that happen. For example, when a bar is cleaned onto the chest, if it is a big weight and it is brought forcibly backwards, it will hit the windpipe, the trachea, which is just above this notch in your neck. When this happens, two things happen. First of all, the voice box can be hit, and that puts the voice box and vocal cords into spasm, and it closes them. So there's no air can go in. The person is trying to breathe, but it can't breathe because the cords are closed. That is an emergency, and you have to think of a way around that. Blowing into the mouth won't do it because the cord's closed, and you have to hope that they will start breathing soon. Sometimes putting cold water on their face or on their abdomen may get them to move, but or their vocal cords, but otherwise they're stuck, and you have to start thinking about moving their chest and blowing the cords out so that when you compress the chest, the cords separate and air can move in and out. And this is pre-hospital care. That is before the arrival of the ambulance. Now, you call the ambulance, and I'll explain why later. Next point, please. What is the data available? Where is all this information found, which I had to look up to present, make this presentation? Well, can we have the next slide? There is none. There is none that is for pre-hospital care. Nobody cares about people who are injured in the gym. They think, oh, that can happen. But we don't know how many people are injured and seriously injured, and of course, some that may die. We've had cases where this happened on the platform. I remember a very lovely lady from Cuba who this happened to, and it was quite dangerous. She started breathing a few minutes later, but she was fine afterwards. Next one, please. These are life-threatening injuries. They're not just injuries with pain and disability for a while and they put ice on it or something. These are where they can damage themselves seriously and this can kill them. Next one, please. Of course, the head is the important thing because that's where the brain is, and your cervical spine, your neck, the spine of your neck. Next one. There we are, the cervical spine. The cervical spine is top of your spinal column. So if something happens here, you're paralyzed all the way down. So you have to be really, really super special, careful about managing somebody's cervical spine problems. Next one, please. This is the windpipe. I mentioned this also. Now, the windpipe has rings of cartilage around it. These rings are very important because they keep the trachea open. There are diseases where the trachea, the rings of cartilage do not form or dissolve with age, and they collapse. The trachea collapses. And this is very dangerous because this is tracheomalacia, it's called, and it needs treatment on a long-term basis. They've done tracheal transplants now in humans. Next one, please. And of course, the chest. If you're doing benching and you drop the bar on your chest, it will not only penetrate the heart or penetrate the lungs and you get a pneumothorax, but the heart may also start going into an abnormal rhythm if it's irritated, if you hit it with a blow. You can do the opposite as well sometimes. In an emergency, if the heart starts to what's called fibrillate, where it's going really fast and really unevenly, you can hit it and it could revert back into sinus rhythm, which is a regular pattern. Next one, please. In life-threatening injuries, the injury may not be life-threatening to start with, but it becomes life-threatening because there's delayed treatment. They hit their chest, as I said, with a bar, let's say, and they think nothing of it. They're fine. They walk around and they're fine. But later on, as the blood accumulates around the heart or the air leaks out of the lungs to cause this pneumothorax, then they start getting problems later, and maybe that evening or when they go home. And if they go to sleep, they may die. Next one, please. Here is a life-changing injury. This is, I remember this athlete very well. You see how the vertebra is, I better do it with the mouse. Here we are. And you see the weight is hit here and dislocated this vertebra on this. Now, behind here, just behind here, in this gap here, the spinal cord runs all the way up, this black line. This is a hollow. And this has stabbed into that, and this is where the spinal cord was. Well, this, of course, is completely damaged. So the head or the spine are very delicate structures, even though you may think that weightlifters have thick skulls. They don't have that thick skulls. And they're life-changing, meaning they would be rendered into paralysis, have bladder problems and bowel problems because they no longer can do their function. Next one, please. Next slide, please. Right, let's think of some of the causes. Next one, please. Failure to take proper precautions particularly affect, these are the things that get affected if you don't take proper precautions. Next one, please. The shoulders. If the technique is bad, with time, you've had it. Your shoulders are going to give way, and the giving way will happen around here, just around here where this point is. And this is the point called, this bone here is called the acromion, and the gap beneath it is subacromion. And if you raise your arm too far, you'll get a sharp pain, or put it behind your back. And that means that this area is getting smaller and smaller, tighter and tighter. Next one, please. The knees, the same thing happens there in the squat. The kneecap should move smoothly up and down with the quadriceps. These are the quadriceps muscles. Quadriceps, 4 heads, because there are 4 muscles that form it. And this causes friction behind the kneecap, and then with time, this causes problems. Another problem, of course, is the patella tendon, this tendon here, which becomes inflamed and then can snap sometimes. Next one, please. Especially if they've had several steroid injections. This is a softening of the tissue and it will snap. And then, of course, you have back problems, which if you leave it, you know, they'll have chronic pain for a long time. And then if they've got a disc or a vertebra out of place like that one, they are in bad trouble, big trouble, if it's not treated quickly and effectively. Next one, please. Now, the most common injuries. Now, that's a power lifter, as you can see. And what happens? Let's have a look. These 3 exercises, the bench, rowing, and deadlifting, are very prone to causing injuries. This is on the data that is available. The second most common injury, if you like, is a feint or syncope, where the athlete just collapses. Next one, please. Sprains, where you twist or damage something, and if you leave it, that affects the ligaments, the tendons, the muscles, the joint. So what looks like an innocent sprain of the wrist or the elbow can be something a bit more sinister, or become that if it's not treated speedily. And of course, direct trauma, where the bar hits the person, like that spine I showed you. Next one, please. Now, if you were there, you may remember this. I remember seeing it. I was walking by the side of the platform, and this is the German who was an Austrian, if you remember. I forgot, what is his name? I've forgotten his name. Yes, Carolina, you were saying? Steiner, that's right. Thank you very much. Super heavyweight, and look at what he's carrying on his neck. This hand, this right hand is doing nothing. The fingertips are just coming off the bar. This is, if anything, he's pulling the bar down. You can see the weight on it. The bar isn't, and his neck is balancing the bar weight. This is not touching the ground yet, and this, of course, not. This foot is in the air. This is on the ground, I think, nearly. So he's just resting on his butt, and this is happening. His neck was, I must tell you, his neck was as wide as his head. And so it was a pretty solid structure. Next one, please. Yeah, this one, let me finish saying it. He may only have had a simple feint. He may just have fainted, but they hit their head on the edge of the platform. This, if somebody comes up, if one of the manufacturers, barbell or platform manufacturers, comes up with an idea to soften the edge of the platform so that if you hit your head, you don't shear it, you don't slice it off. The other thing is, do not move the athlete unless breathing is affected. This is so important. The first thing the coaches do when they see, they rush on and they lift the athlete up. You know, that's going to really do them no good at all. Next one, please. If they're unconscious, assume, just think it could be a fracture and you can't see it, or you haven't assessed it carefully, then they will get worse. So if they're unconscious, assume a fracture. You can't ask them questions because they're unconscious. Next one, please. Now, fractures and dislocations. Why are they important? Not just because they're fractures, but the fact that a long bone like this, a femur, thigh bone, can bleed about 1 or 2 units of blood, that's a pint of blood, about 500 mils, into the thigh. And this is such a sudden fracture. You can see that there's no swelling around it yet, but that will form as that bone end bleeds. Common Fractures are common, unfortunately. You will stabilize and relieve the pain on the platform if necessary. That is either with Entonox, if you can get it, or with thiopentone, which is like a vaping cigar. And that will relieve the pain if necessary. But we have to have permission to use this. And if there are doctors in the audience, remember, we are very strictly controlled what we can take into certain countries, and Japan particularly. They will have everything that we need if we ask for it. Thank you. Next one, please. Be concerned if a long bone is fractured, leg, e.g. thigh. When stabilization and compression, if you compress it, it will hopefully hold it, but you need to stabilize the bone, otherwise the bone will rub against each other. The two ends will rub, and it is not painful. Not only painful, but also it will cause more bleeding. Next one, please. Remember, it may feel on a plain X-ray, it may feel, oh, it's just a sprain of the elbow ligaments. No, look, this is what's happened. The whole bone has come off the bottom of the humerus. Next one, please. And seriously consider referring for an MRI. If in doubt, do it. Don't wait for it to happen. Next one, please. Now, this is the faint, the syncope. You know, there are some people who just keep fainting. It's common, but results may be serious, such as striking the head on the edge of the platform, dropping the bar, or whatever else is written under there. The most important thing here is look at the way he's lying. You don't know if he has hurt his spine. You can't get a story out of him because he's unconscious, and he may have damaged his spine. You need to sort it out. Next one, please. Do not attempt to stand the lifter up. Please don't touch the lifter. And the two doctors usually will come up in a serious emergency. The two of them will come up. The most important thing here for you to do as a coach is to stay off the platform. Don't crowd the people who are trying to work. It may only be a feint, but that's what you do. Next one, please. Next slide. If no spinal injuries are detected, undo the belt if he has one, and raise the legs. Make sure he hasn't got any fractures of his legs. If he has, the bar hasn't hit that as well on its way down. So spinal injuries are the things you want to protect against. Next one, please. Most common to all injuries, what are the causes? And the causes are you fail to take proper precautions. You haven't looked to see if there is something more than just blood, or if the bar has cut the skin, or they are complaining of a lot of pain in the elbow, but the fact is that their knee may also be lying at a different angle. And here you'll see on this beautiful MRI, this is fluid. Now you shouldn't have fluid in these areas. And why have you got fluid here? Because there's muscle, the tendons have been ruptured. This is friction. And this bone here, this is a bone called the acromion. So shoulders, next one, and the knees. Now the knees, when people say, oh, I damaged my cartilage, there are two forms of cartilage in the body. One is hyaline cartilage, which is the smooth, shiny covering on a bone, which gives it like nylon covering on a bearing. You see it in a chicken drumstick if you see that shiny bluish white surface. But there's another cartilage, set of cartilages. These are the menisci. They're called menisci because they look like half moons. One on medial inside and one outside. And these are very important to maintain the function of the knee, and they'll be ruptured. How am I doing, Carolina? Okay, thank you. So we talk about the cartilages there, and the thing is, if the cartilage tears, the meniscus tears, it will fold back on itself usually, and then you're jammed. The whole knee locks, it will swell, it will give way. It is just a useless joint. They can't even walk on it. They can't even get out of a chair. They can't even bend it. It will be locked. This needs serious attention, and an MRI is the way to identify the problem. Next one, please. Next one, please. The back. Okay. Next one, please. Now, the back I've mentioned already with what happens, and you may think they've just got a twinge, they've got a twist or whatever, but it may be more. And impingement, this word impingement means pinched. And this is where it gets pinched. As time and training goes on and they get older, the gap here gets smaller and smaller and smaller and tighter and tighter and tighter. And then the tendon gets more and more pinched, and eventually it snaps. And that is big problems. Next one, please. And that is called a rotator cuff tear, because the rotator cuff is 4 muscles in the shoulder, which make it do so much more. Next one, please. And this is what we have to identify by research to show the technique and the balance of the individual, and things like this for the knees, you see, for the squat. And there's very poor data. If somebody wants to do a research project, do it on this, because this is very useful for old weightlifters, and perhaps coaches ought to be treated with this information. Next one, please. There are various studies and protocols. It has been looked at, but I'll tell you why the data is poor, because it's not accurate enough. Next one, please. A variable number of lifters were included. So some projects had, some protocols had 9 lifters, nothing. And others had 19, or some had 5 and others had 15, you know, different numbers. And the more you get in the sample size, the more accurate your results. And with few few lifters included in your work, it doesn't hold much strength. Next one, please. The most common injuries found are, next one. The site, yes, please. Knee, and the cause is squats. That's no doubt. Next one. Shoulders, rotator cuff impingement, which I mentioned about. So be careful. What may be a twinge may turn into something more significant, and this will result in old age problems or middle age problems even. Next one, please. Now, when do we use surgery? I hope you never see this, because you should be under the anesthetic now. You shouldn't be awake to see this coming at you. Rotator cuff tear, I'll explain in a minute how that is repaired. There are many different ways. Nowadays it's done with arthroscopy, but with big tears, it's best to do it through an arthrotomy where they cut it. Biceps tendon inflammation, just biceps. Knee meniscal tear, which I told you about a little while ago. Next one, please. And this, the Achilles tendon rupture. The Achilles tendon is an extraordinary structure. It's very, very strong, and it will rupture rather than anything else. It occasionally gets inflamed with forms of arthritis like Reiter's disease and so on, but that's rare. What is more common is trauma. And the symptom that the person mentions when they rupture the tendon is they feel as if they've been hit on the back of the leg. So people playing squash, when they're playing squash, they look at their partner and say, "You person, why did you hit me on the back?" It wasn't, it was the tendon rupturing. Next one, please. And tendonitis, which is inflammation, that usually resolves with injection. Now, the data took 10 years to accumulate, and that's what they found. This is all they found. And this is from the Trier Institute, and this came out just a couple of years ago. Next one, please. Several other papers, and there's a failure to mention number of patients, for example, whether they had an MRI, whether they did ultrasound, and some did weights, whatever that means. You know, it could be powerlifting, it could be bodybuilding, just keeping fit. So it's worth crumpling up the research and throwing it in the bin. Next one, please. How often the lifting goes on. Now, this is, again, you see what's happened there. He's lifting quite a big lump of weight. Acute injuries, 59.6%. That's acute, that means sudden injuries. But chronic, you see, it's a third of them are chronic, meaning the pain has carried on and been ignored. Next one, please. Where are these places? Next one, please. Muscles and tendons. Powerlifting and bodybuilding are the main culprits because they work on a group of muscles rather than a technique. For weightlifting, the incidence is 2.4 to 3.3 injuries in 1,000 hours of training. And for powerlifting, it's much less, for the range. But you see the range is fourfold here. It's not so, it's pretty tight. But the great thing, if you want to impress your colleagues in other sports, say that we are a safe sport. The injuries that we get, you see, once in a while we'll get a dislocated elbow, but look how uncommon it is otherwise. Thank you. Next one, please. Where does this happen? Oh, yes. These are the sites. Look, there were 5 databases used in this, and there were PubMed, Medline, and 3 other databases were looked at just to get what data I've shown you already. The sites they looked at were similar to other research papers. Next one, please. And the management. Now, this is important. When the injury happens and the athlete is lying on the floor, first, check the surroundings and summon help. Get your phone the emergency number for ambulance. Take a colleague, if there's somebody else, anybody else, stranger or whatever, get them to come in and help you. Secure the surroundings. Make sure there are no bars hanging off stands or blocks or something about to crush you as well. Next one. Do not move the casualty. Please don't do it because you will cause more problems until you have assessed them. Obtain a history if possible. If they're awake, if they're conscious, you should say what happened just quickly. Next one, please. Check their breathing and pulse. And you can do both here on the neck, the pulse, or just put your hand on the heart. And check if casualty can communicate, and if possible, ask what's happened. Next one, please. If they're not breathing or communicating, ask your colleague if he's there to hold the head, stabilize the neck, and together, you on the body and him on the neck, you roll the patient back onto the patient, lifter onto their back, and you check breathing again. We don't do M2M, mouth to mouth. It's not done now. You check breathing again. If there's still no chest movement, you pull the jaw forward if they haven't hit it with the bar, and you commence chest compressions. The compression of the chest will do 2 things. One is if the heart is not working so well, it'll speed it up. And the other thing is it'll compress the lungs so that the person will be moving air in and out. Next one, please. Monitor. Don't just do it and think you're all right. Thank you. You've got to keep looking, check the color, chest movement, and pulse. Next one, please. And if casualties can talk, ask if they can move and feel their toes and their fingertips. And if so, stabilize the position and await the arrival of the ambulance. Meaning, if they can feel their fingertips, it means sensation is there. And if they can move their fingers, that means the power is there. And the same for their ankles. You won't be able to take their boots off, then socks off. So just test the ankles. The other thing about this is so important. They may be shocked, and so they may be saying rubbish, talking rubbish, and so you have to take that into account. Next one, please. Summary, please. First one. Check for safety, summon help. Second one. Do not move the lifter unless breathing is affected. If the breathing is affected, you've got to breathe for them. Third one. If you have moved them, check for breathing again and move their jaw forward if you have to. Next one. Release the belt if possible, meaning sometimes the belt is bloody difficult to move, but you have to somehow do it. Next one. Check consciousness, see if they're awake and see if they can talk sensibly. Next one. Ask where it hurts. Where did the bar hit you? Next one. Check for movement and sensation of fingers and ankles. I told you that. And then, if not breathing, carefully stabilize the neck and start chest compressions. Next one, please. And continue until breathing starts spontaneously. or until the ambulance arrives. Next one, please. Remember, you only have 4 minutes to restore the circulation before the brain dies. You're the people, you're God, you're acting as God. You will resuscitate that person and keep them alive and free from injury for the long term or not. You have only 4 minutes to restore circulation before the brain dies. There we are. This is a few minutes of telling you how to keep people alive. I hope you never have to use it, but if you do, remember, just read that again. Bless you all. Thank you.
Thank you, Dr. Mike. Yes, of course, we hope that we're not in a situation where something like this happens. I have a question about the syncope, just as basically an athlete who, you said that it's not dangerous itself. And for example, I have had an athlete who tends to pass out.
Oh, yes, we know him. Yes, very well.
Yes, exactly. And now we go to the competition. As a coach, we're pretty used to the fact that, I'll just undo his belt and put his legs up. But then you go to the international platform, and it does look quite wild when an athlete does pass out.
Yeah. Sometimes on the steps to the platform, is coming down and then he collapses there, just testing us.
Yes. And so basically, any athlete, when a coach goes to a championship, is there any reason for a coach, for example, to go and tell them that this athlete does have syncope and that it's possible that would happen? I know that this particular athlete he has also, I want to get on the platform, I want to lift. And everyone's like, how can you lift?
Yeah.
So
the thing is, yes, I think it's a good idea to warn the medical team that this is what might happen, and also the TC, because he's controlling the platform.
Yeah.
And he will keep some new coach who doesn't know him, keep him away. No, he's well known to us, and we are very happy to treat him when it comes. But the thing about him is that it's not the feint that would hurt him. It's when he hits the ground or the step, falls down the steps or hits the edge of the platform. We were thinking of asking Aleco or some other company to have a rubber wedge at the end of the platform. And if they're lifting the bar and walking towards the edge, that's okay if they don't step off it. And if they fall, the rubber would cushion the shock to an extent, but they've got to think about this and get permission to do it. Yeah.
Okay. Thank you. Yes. So basically, if you are out there with an athlete who does tend to do that, contact the technical controller or the medical team and just warn them that you have this situation. Dr. Irani, thank you very much for your presentation. And so those of you who want to look at that presentation, if you send an email to IWF, we will then see that a PowerPoint is available. And you can, of course, review it again on the YouTube channel. Thank you.
Pleasure.
Okay, moving on to our second presentation. And here, as our second presentation, we have Dr. Junichi Okada, and he joins us from Japan. He serves on the IWF Coaching and Research Committee. He was the head coach for weightlifting for Team Waseda University for 20 years and is currently the general manager of the team. So research is close to Dr. Okada's heart, and together with other Japanese researchers, they have completed 2 studies in the snatch lift. So which parameters show deviance when lift is missed forward, and then which parameters show deviance when the lift is missed backwards? These unsuccessful lifts are then compared with the same athletes, same weight of a successful lift. So let's hear what the numbers tell us. What do we need to take into consideration? Ladies and gentlemen, Dr. Junichi Okada, welcome.
Thank you, Carolina. Sorry, I'll show you my presentation with a recorded video beforehand. Let's see. Thank you, appreciate for introducing me. Today, I'd like to present research data from the world event. For several years, the Japanese research team filmed world senior and junior events, and they have published some articles in scientific journals. Japan Institute of Sports Science, JISS, supports weightlifting strongly. The project leader, Dr. Nagao, had been sitting at the competition venue every day to get data from all athletes and their attempts. The title of this topic is a comparison of barbell kinematics and kinetics during successful and unsuccessful snatch attempts among elite male weightlifters. Of course, successful means good lift, and unsuccessful means no lift. The research team of JISS executed correcting data via World Championships. They got the opportunity to film some World Senior and Junior Championships for several years. And they already published some research papers in the journals. The latest report discussed successful and unsuccessful snatch lifts, focused on the frontward drop for the 2017 Senior and Junior World Championship. And next, we try to put another viewpoint that it means the barbell dropped backward. From these approaches, we will be able to discuss totally of the tendency. Here is a sample movie on this topic. This lifter took the same weights, 165, in his attempt at the World Championship. We already published successful and unsuccessful lifts with a frontward drop in the article. This presentation includes another case of no lift. It means an unsuccessful lift with a backward drop. Snatch attempts were recorded using a digital video camera. For the two-dimensional analysis, the barbell trajectory in the sagittal plane from the left end of the barbell was digitized. The barbell plate diameter 0.45 meter was used as a reference to calibrate the barbell's real space positions. The next slide shows the subjects. The data in this study included successful and unsuccessful snatch lifts achieved at the same weights in the same lifter derived from Junior and Senior World Championships in 2017. In the case of the unsuccessful lift due to a backward barbell drop. 9 seniors and 11 juniors, a total of 20 athletes listed here, included the analysis. These movies are one of the senior lifters. He missed in the first or second attempt and then he did it the following effort. We sampled these cases. The definitions of the motion phases and events of the snatch lift are shown here. We made some landmarks in the barbell trajectory. Start position, most backward position before peak vertical velocity. Peak vertical velocity appears around here. And through the top, it means maximum height. And then bar reached the catch position. First pull, second pull, turnover and catch. Each phase is defined based on these landmarks. This slide shows the parameters of the bar. The above section is vertical y-axis variables, and below is horizontal x-axis variables. Large D means distance data. Its unit is meter. Small p means peak. Large V is velocity, and its unit is meter per second. Large F is force, and the unit is in Newton. Large P is power, and this unit is watts. This figure is better for your understanding. Vertical and horizontal distance parameters are here. Peak force, peak velocity, and peak power variables were calculated based on the phases. First pull and second pull phase. This slide is statistical information. Paired t-tests were used to compare all barbell variables between successful and unsuccessful snatch lifts. The level of significance was set at p less than 0.05 for all statistical tests performed. It is showed comparison pictures between the successful good lift and unsuccessful no lift of the barbell trajectory in each athlete. The dotted line shows no lift. The solid line shows a good lift taken the same weight. Some athletes showed almost same line, or backward direction started from the start. And another showed different lines, obviously. The left one was a case of no lift is higher than the good lift. Here, and this Korea and Taipei mean bar moved forward at second pull and then dropped to the back. I consider that it appeared swing motion. In this way, we can find several patterns and guess each failure status. However, as a research, we should compare it with the statistical differences. We can find some statistical differences in the table. From the upper line, dy3, maximum height to the catch position. It means drop distance. The good lift was smaller than no lift. PFY second and PPY second. Maximum vertical linear force and power in the second pole. The good lift was a larger value than no lift. DXL, distance of most forward position to the catch position. DXR, distance of most forward position to most backward position. dy3, maximum height to the catch position. And PFX minus, maximum horizontal force in the backward direction. But there was no difference in the dy1, maximum height of the barbell. Discussion. In this study, there were no significant differences in the barbell parameters of maximum barbell height, dy1, start position to the catch position, dy2, between successful lift and unsuccessful no lift with backward barbell drop. This result is the same as unsuccessful lifts with frontward barbell drop.
But you can talk to me. I would like you to
It
talk.
follows that
I would like you to
the
talk.
maximum barbell height does not
I've
determine
told you
the
to
success or
contact
failure of the snatch lift. If the weight
we will both then.
is the lifter's personal best or less.
Hello. Can we maybe do so that Dr.
Thank you.
Unichi, can you
There were
maybe
significant differences
rewind?
in drop distance, dy3, between
Can
successful and unsuccessful lifts with a back barbell drop, successful, less than unsuccessful.
Is that a good point for you to
This
continue
result
on?
is the same as rewind.
Maybe take it back. It is at 1344. Maybe take it back to 1230, something like that. That
In
looks
this
very
study,
good. Thank
there
you.
were no significant differences in the barbell parameters of maximum barbell height, dy1, start position to the catch position, dy2, between successful good lift and unsuccessful no lift with backward barbell drop. This result is the same as unsuccessful lifts with frontward barbell drop. It follows that the maximum barbell height does not determine the success or failure of the snatch lift, if the weight is the lifter's personal best or less. Point 2. There were significant differences in drop distance, dy3, between successful and unsuccessful lifts with a back barbell drop, successful, less than unsuccessful. This result is the same as unsuccessful lifts with frontward barbell drop. We can infer that the lifter would catch the barbell in successful lifts when its momentum was low by decreasing the drop distance to the catch position after the barbell has reached its maximum height. Point 3. There were significant differences in the barbell parameters of backward displacement, dxl and dxr, between good and no lift with a backward barbell drop, successful, less than unsuccessful. This result is different from the case of a frontward barbell drop. In the case of unsuccessful lift with frontward barbell drop, the successful lift of dxl and dxr were bigger than unsuccessful. Therefore, barbell backward distance is very important for snatch to succeed. Point 4. There were significant differences in the barbell parameters of maximum horizontal linear force in the backward direction Pfx- between successful and unsuccessful lifts with a backward barbell drop. Good lift, less than no lift. Therefore, we consider that the peak backward force applied to the barbell and the barbell backward displacement were factors associated with a successful snatch. And here, let you know the results from frontward drop data. It's a brief review of the previous report that I already mentioned. '61. Junior and senior lifters had successful and unsuccessful snatch lifts taken at the same weights with frontward drops in 122 total snatch lifts. Significant differences in the no lift were higher drop distance, lower vertical force in second pull, and small horizontal distances. In the case of no lift with a frontward drop, there is less force output and not enough backward movement, and then the barbell dropped on the forward. This slide is the last one. In the previous study, Dr. Stone suggested that lifts with a backward displacement of the barbell are also regarded as a positive technique for producing force. However, from the perspective of the successful snatch lift, the amount of backward barbell displacement is in the appropriate range, with neither maximization nor minimization of either parameter. The mean differences in DXL and DXR between successful and unsuccessful lifts were 2 centimeters. It was less than the thickness of the barbell shaft diameter. The proper catch position, which determines the success, good lift or failure, no lift, of the snatch lift is very sensitive to the barbell's horizontal position. From these elite male weightlifters, we accumulated the range of backward displacement of the barbell is around 10 to 15 centimeters. The distance of 10 to 15 centimeters was derived from just this study with barbell trajectory. This study did not include the lifter's body analysis, so there are some restrictions on this understanding. I know that this distance does not a universality value. Another lifter maybe makes different results, case by case. But this analysis included from the lightweight to the heavyweight category, so none of the general problems regarding the body size. This report is one of the case studies. However, this had resulted from the average value in the highest world event of weightlifting. I appreciate your attention.
Okay.
Thank you, Dr. Yunichi. And for everyone, you can see his email address there so that I know this was not my first time listening to this, so I'm a little bit more prepared than the rest of you guys. So I have a question for Dr. Yunichi. And so this is what I get out of this, that when lifting, so basically as a coach, my athlete is either lifting straight, and now this was, let's see, here we go. So this study talked about a little bit more of a lean forward. And the question is, how much do you get horizontal into the kick, is it upward or is it also with horizontal? This, of course, is always something that the coach has to decide. Am I going to teach my athlete upward thrust, or shall I let them use the back more? Did you find something in the study when your research team, when you did this, that you would say that you could sort of guess which type of athlete would benefit from this 10 to 15 centimeter horizontal movement? Dr. Yunichi.
It is difficult, but I think most important parameter is vertical force. So horizontal displacement is just result from each athlete. Most important factor to lifting barbell is force and power to the horizontal, but vertical power and force. So another study, we got almost same data from Asian weightlifters, Chinese and Taipei, Japan, and so on. So good lifters horizontal displacement is smaller than low-level lifters.
Okay, that's nice to know that also, because as the study did state that the body composition, as in the body analysis, was not in that sense taken into consideration, but that more lifts fall into this same area. Okay, I don't see any questions coming into our Q&A. So do you have something to add, Dr. Junichi? Do you have something to add? Okay, we will move forward then. Thank you, Dr. Junichi. And joining us also, we have the Coaching and Research Committee Chair, Mr. Mahmoud Magoub. Hello, Mahmoud, who has joined us also. Would you like to say hello to everyone?
Thank you to everyone here. Thank you for your coordinating report. It's nice, good to know. And also, my thanks to all the presenters. I hope we can get more information to our coaches. Thank you.
Yes, thank you, Chairman. Okay, moving on to our last presentation. And for this one, maybe some of you guys have watched the movie. Dr. Kyle Pierce is a member of our IWF Coaching and Research Committee, as well as the personal coach to three-time Olympian Kendrick Ferris. Kendrick appeared in 2018 in the documentary, The Game Changers, telling about his experiences with a plant-based diet. No meat proteins or dairy products. All of his energy and building blocks for the muscles come from plant-based foods. Dr. Kyle will tell us about his personal experiences and also what coaches need to know when working with special diets. So hopefully you had a chance to watch the documentary, available here in Europe, at least in Netflix, where Kendrick appears around the 15 to 17 minute marker. So ladies and gentlemen, Dr. Kyle Pierce.
Thank you very much. Okay, let's see. Okay, the title of my presentation today is Nutrition for Athletes and the Role of the Coach. So I'm speaking as a coach. I am not a dietitian or nutritionist. I don't claim to be. I'm a coach that likes to seek out evidence-based research to support the methods that I use in coaching. So these are some topics I feel that are important to the coach, and we'll go over these. Now, I've got a lot of slides, so I may not cover everyone completely, but the PowerPoint is available if you wish to have it later on. So I have a little bit more wordy than what I'll actually cover here. Now, first thing I think a coach should seek out if in an ideal situation is professional support. That's not available to all coaches. It depends on what country you're in, what your support system is. But ideally, you'd have a dietitian or nutritionist. And the statutory professional regulations will vary from country to country as to who is a professional, who's certified and registered, not self-titled. There's a lot of self-titled dietitians and particularly nutritionists out there. So preferably you'd have one and access to one that's a sports dietitian, and even more particularly with an understanding of strength power sports, and even more particularly weightlifting. Now, there's a lot of diets out there. There's popular diets, and I put fad also because some of these won't be around very long. Some of you are familiar with these. We're not going to cover these. The ones we're going to focus on today are vegan and vegetarian diets, as well as some just general nutrition information. Now, with vegetarians, there's different types. The vegan does not consume any animal products, no red or white meat, fish, fowl, anything derived from animals, including in many cases honey. The lacto-vegetarian, they consume dairy products, but no meat products there. No animal products other than the dairy. The ovo-vegetarian will consume egg products, while the lacto-ovo-vegetarian will consume both dairy and egg products. So those are the different types there. Some people will include a pesco-vegetarian who will, in addition to a vegetarian diet, eat fish. There's other categories: flexitarian, someone that occasionally consumes animal flesh, and then the fruitarian, who primarily eats fruit with some vegetables. Okay, so one of the things we want to look into today, do vegetarian and vegan diets improve athletic performance? Because that's, you know, as a coach, that's what we want. Are they better than omnivorous diets for improving athletic performance? So what we need to do is look into the literature a little bit. And so what I've done here basically is taken some quotes from different articles. These are primarily review articles. As we see here, this is from more of a review on vegetarian and vegan athletes. And this is a recent study this year, a recent review, I should say, with proper planning. And note some of the things I've bolded here. Proper planning, that's the thing that's going to be coming up several times here. Athletes can achieve all their nutritional needs through vegetarian or a vegan diet. There's certain considerations, and some of the things that you need to worry about are iron, zinc, calcium, vitamin A, B2 and B12, iodine, vitamin D, and overall energy intake. So you need to be concerned with that if you're a vegan or a vegetarian. This particular review goes on to mention that you can meet protein requirements just like an omnivorous diet, as long as your plant-based diet includes all the essential amino acids, including leucine, and total protein intake through the day. While more studies are needed, plant diets might even provide certain health benefits along with the performance benefits. Some of those include a reduction in obesity, reduction in hypertension, excellent cardiovascular benefits, reduction of type 2 diabetes, as well as cancer mortality. Again, we see with the right meal planning, an athlete can not only meet all the nutritional requirements of plant-based food, but also enjoy similar strength, power, aerobic and anaerobic exercise performance. Note the planning is just like with training. I mean, we need to plan. So that's a major consideration, is the planning. Not many differences according to this particular review. The differences in performance and strength remain an area of interest. And as you'll see, a common theme through here is there needs to be more research. We don't have all the answers yet, and more research is needed. One study I found that was done recently looked at untrained individuals who were habitually already on a vegan or an omnivorous diet. And they trained for, I believe it was 12 weeks. They were untrained, and at the end of the study, there was really no difference in their gains. Some conclusions from another review is that in general, vegan diets tend to be lower in calories, protein, fat, B12, N3 fats, calcium, and iodine. However, they are higher in carbohydrates, fiber, micronutrients, phytochemicals, and antioxidants. This review goes on to say that sometimes it's difficult in achieving high energy intake. Sometimes there's issues with digestibility and absorption of nutrients such as protein, calcium, iron, and zinc. That might be an issue also, so that needs to be considered. They also indicate that the vegan athlete might need to consume higher amounts of some of these of foods compared to omnivores or other vegetarians. However, again, through strategic selection and management of food choices, with special attention to the achievement of energy, and possibly along with appropriate supplementation, we need to be very concerned and look into what supplements are being taken. But they can achieve their needs through a vegan diet. Supplementation with creatine and beta alanine might help performance in vegans, as vegans sometimes have low pre-existing levels of these substances. However, again, more research is needed. Now, some of the things, if you look into studies yourself here, these are considerations. These are considerations not just for nutritional studies, but oftentimes other training studies as well. Aerobic versus anaerobic. Sometimes we see a review and it'll talk about sport. Well, what sports? Aerobic or anaerobic? Endurance versus strength power athletes. Sometimes there's different responses. Trained versus untrained, okay? Also note the methods and performance level of the athletes. I cannot find any studies on elite weightlifters regarding vegan athletes. So we hear, people will hear some testimonies, but to my knowledge, I've not found any controlled study. So you need to consider that. Oftentimes in studies, males versus females, one of the things you may consider is there may be improvement with a vegan or vegetarian diet because maybe the previous diet was not good. Again, we talk about this planning and we talk about making wise choices in the athlete's diet. But again, these things can be, if you're looking at research, these are some considerations here with other research that you're looking at regarding strength and power and performance in weightlifting. Some considerations with vegan athletes. Sometimes they need to eat frequent meals and snacks. Of course, as it says, meeting energy requirements is crucial for obtaining proper nutrition to optimize training, adaptation, and performance. Again, we see this repeated. Protein, omega-3 fatty acids, calcium, vitamin D, iron, zinc, iodine, vitamin B12, and riboflavin are found less abundantly in plant compared to animal foods or are less well absorbed. According to this author, that you may need some supplementation, but it needs to be well thought out and looked into before you do take any kind of supplements. Now, just some basic nutrition that I think, as I mentioned, this is about the coach. This is for the coach and some things they need to know. Nutrition is necessary for energy for top performance, maintaining desired body composition, recovery, recuperation, and restoration. We got to recover. You know, the whole key is recovery adaptation. If we don't recover and we don't adapt, then our performance will decrease or there'll be no change. Of course, we want it to increase. Essential nutrients, we have macronutrients, micronutrients, and water. And we'll talk about each of those. Carbohydrates, sugars, and starches, preferred fuel and intense energy. Of course, excess is converted to fat, and generally it's about 50 to 58% of our caloric intake. Now, these are basic carbohydrate sources: fruits, vegetables, rice, pasta, potatoes, bread. Those are the better choices. There's some cereals, cakes, pastries, honey, and sugar. Now, proteins needed for growth and repair, made up of amino acids. We need all the amino acids to form a protein. It's about 12 to 20% of the caloric intake. And weightlifters may need as much as up to 2.5 grams per kilogram of body weight per day. That's in an extreme case, but there is evidence that that has occurred. These are all the amino acids. Of course, the essential ones are the ones that the body cannot manufacture, and we need to ingest these. Now, the information I've read from vegan and vegetarian diets is basically the same there as far as the requirements. And of course, I put this in here to note that it must be aligned with their athletic requirements, okay? So it depends again on the sport and your intensity of training and volume. Protein consumption by vegans requires attention to the quantity and quality of protein consumed, as it's often incomplete and doesn't contain all the amino acids. So the variety of foods that a vegan eats is very important. The Academy of Nutrition and Dietetics has recommended that vegans consume, again, a variety of plant-based proteins to meet their protein and amino acid requirements. In particular, foods such as grains, legumes, nuts, and seeds be included in the diet to make sure that they get all these essential amino acids. Some protein sources are fish, poultry, chicken, turkey, meat, milk products, cheese, and eggs. Some plant-based protein sources are soy products such as tofu, beans, lentils, nuts and seeds, and most grains such as quinoa. From another source, pumpkin seeds, lentils, black beans, almonds, tempeh, tofu, oats, quinoa. Now, complete proteins are, of course, our animal products are complete: milk products, eggs, fish, poultry, meat. Quinoa, depending on the research, may or may not be complete. Then, of course, we need to put foods together to get the complete protein, such as grains and legumes and nuts or seeds, grains and dairy, legumes and dairy will work as well. So, for example, peanut butter and whole wheat toast will work for vegan, raw vegetables and hummus and whole wheat pita, brown rice and green beans and corn. But this has to be researched. You have to investigate this. You need a professional, if at all possible, to help you set up the diet so that you're eating complete proteins. Fats, concentrated energy sources, carrier fat-soluble vitamins stored in muscle and in adipose tissue, 9 calories per gram of fat, as we have just 4 with carbohydrates and protein. And it should be 25 to 30% of the caloric intake. Now, that's caloric intake. That doesn't mean 25 to 30% of your ingested calories need to be fat. Vegan diets are lower in total fat, and saturated fat, richer in omega-6 fats. Studies have shown that low-fat diet can negatively affect testosterone levels in men. So reaching recommended values of 0.5 to 1.5 grams per kilogram per day, or 30% of the daily caloric intake. It's still possible for vegan athletes to consume the right amount of oil, avocado, nuts, or seeds to achieve that. So essential fatty acids are linoleic acid and linoleic acid. These are both important for normal immune function and neurologic function. And if you're on a very low fat diet, you may be deficient in these. So fat is essential. Some fat sources, of course, in our animal products, such as milk and meat, cheese, butter. But we also get them in nuts and avocado. We know that there's saturated and unsaturated fats, and of unsaturated, there's poly and monounsaturated fats. Trans fats are the hydrogenated fats. Those are great preservatives, but they're not very healthy. So those are the things you want to try to avoid. Saturated fat sources are from meat, chicken, palm, and coconut oil. Polyunsaturated fat sources include fatty fish such as tuna, mackerel, salmon, corn oil, and sunflower oil. Monounsaturated fat sources include olive oil, peanut oil, and canola oil. Plant-based fat sources include nuts such as almonds, walnuts, peanuts, avocados, oils, flaxseed, chia seed, and hemp seed. Now, the trans fat sources, all the things that we like, okay? Ice cream, cookies, non-dairy coffee creamers. I've never seen a non-dairy coffee creamer that didn't include trans fat sources, so they're not the most healthy thing. Chips, all those party foods there, okay? Get rid of those. All right, cholesterol. Basically two types. We have low density lipoproteins, the LDLs, they're the bad ones. They promote atherosclerosis, clog up those arteries. Their levels are increased by saturated fats and trans fats. Of course, high density lipoproteins, they lower the risk, and their levels may be increased by monounsaturated fats and exercise. A balanced diet, depending on who you read, would be about 50 to 58% of total calories from carbohydrates, 12 to 20 from protein, and 25 to 30 from fat. Okay, and that may vary depending on who you read there. For weightlifters, 50 to 70 calories per kilogram of body weight. And it may vary up to 8,000. Of course, we've got all those body weight categories. Vitamins, these are micronutrients, part of the enzyme system, not direct sources of energy. We have two types, water soluble and fat soluble. Water soluble, B and C, are the ones that just go through your body through the day. We can store up A, D, E, and K, and we need to be careful not to overdo A, D, E, and K because they can cause some problems. In fact, we should keep more balance and not overdo things. It's just as much of a problem to overdo things often as having too little. Minerals are inorganic substances involved in many body functions, including muscle contraction, such as calcium, iron, and potassium. According to Larson-Meyer, there's less iron, zinc, calcium, vitamin D, iodine, vitamin B12, and riboflavin in some of the plant-based foods, and consumption of fortified foods or supplements should be considered if that is an issue. Water, can't forget that. 2/3 of body weight's water, 75% of muscle. We don't store excess water. We use a lot during exercise. Thirst is not always a good indicator of dehydration. I've encouraged athletes and during competition to make sure they hydrate, and I know Kendrick one time came back and told me that he said he was drinking enough, but got tested after competition, and he said they told him he was dehydrated. So thirst is not always an indicator of dehydration. We need to encourage the athletes to constantly drink water. Ideally, 5 to 6 meals would be better than 2 to 3. We'd have better insulin control, blood sugar more constant, energy levels more consistent, and less fat gain. Ideally, we should choose food over dietary supplementation if at all possible. In certain cases, supplementation may be necessary. But again, get a reliable source. Eating disorders. This is important. Some of the major eating disorders are binge eating, bulimia, which is binge eating, followed by purging, fasting, or excessive exercise, and anorexia nervosa, which is a reduction in food intake. And these are important. These are things that coaches need to be aware of. There may be instances where an athlete's may be reducing their food intake, maybe an anorexic, and they're claiming that the reason they're not eating so much is they're a vegan or a vegetarian. So they may be using that to cover something else up. Also be concerned with the red S, relative energy deficiency in sport. And as it says here, a broader, more comprehensive term for the condition previously known as the female athlete triad. Refers to impaired physiological function caused by relative energy deficiency, including but not limited to metabolic rate, menstrual function, bone health, immunity, protein synthesis, cardiovascular health. And again, not just for female athletes, male athletes are also affected. The cause is energy deficiency relative to the balance between dietary energy intake and energy expenditure required for health and activities of daily living, growth, and sporting activities. And also there's some psychological consequences as well. It's a potential problem in some sports, not typically in weightlifting. However, if we do see it in weightlifting, it's more common among the lighter classes or somebody's trying to drop a body weight class. Now, this is what is important. This is important for all the eating disorders. And again, you know, the topic in the presentation is the role of the coach. And the role of the coach here is the coach is not responsible for diagnosing or treating this disorder or any eating disorders. They should be aware of the symptoms associated with it and refer the athletes to appropriate professionals. Get the athlete to the doctor, okay? Don't try to do things yourself there. Seek out that professional help. One thing I'd like to mention also, I always like to push accessing quality information. Ideally, try to get peer-reviewed articles. And even with that, when you get it, don't just read the abstract, read the whole article. Note the sample size, level of performance, ages, length of the training, baseline measurements, and the type of exercise being performed. Differentiate between activities, aerobic, anaerobic, resistance training, weightlifting. I've mentioned this before, but I think it's good to mention it again. Opinions, blogs, article in the popular press that we find by Googling the internet there and social media. They're not often the best sources of information. And finally, don't make decisions based on one study. I presented several studies earlier on. Some of those had some of the same results there. Some may have been conflicting a little bit, but don't just pick one study. Look at the overall body of research in whatever area that you're looking at. These are two that I use a lot, search engines, PubMed and Google Scholar. Now, these are just in summary, the role of the coach. Ideally, related to nutrition, if you can work with a dietitian, you're better off doing that. But again, that's not always the case. And if you do have the access to a dietitian, hopefully that they'd be familiar with strength power athletes, particularly weightlifters. You may have to educate them on that. If not, and you've got to find out all the information, seek evidence-based research to educate yourself and your athletes. Also educate the parents or those that are preparing the meals and the snacks. Okay, you may know about it, the athlete may know, but somebody else is fixing the food. Try to get that, provide evidence-based literature, get that to your athletes, get that to their parents or those that are preparing the meals. Don't force athletes to adopt your dietary beliefs. Just because you believe something doesn't mean that all your athletes need to do that. Sometimes it's good to seek information specific to your country. We eat different things throughout the world, so you may have to seek information out in your own country that may fit more your specific needs of your athletes. One thing is that coaches often have to work within the parameters of their athletes. You know, there's athletes that are Muslim and during Ramadan, there's fasting and that needs to be accommodated for. And the coach needs to be aware of that, okay? So the coach needs to keep up oftentimes with some of the different dietary habits that are occurring and those that their athletes pursue. And you should give them guidance, but if they should choose to be a vegan or a vegetarian, I believe the best thing you can do is try to provide them with good information, either through professional help, ideally, or with evidence-based literature. And finally, be aware of disordered eating signs and symptoms, because this is the role of the coach, not to attend to that and try to diagnose and treat it, but to get that person to a professional. I've provided a few nutrition resources here that, when this goes up, might be helpful to you. I'd like to thank Dr. Mike Stone. He's always helping me out any kind of presentation I do. He's busy, always doing something, writing and presenting, but he always takes time to look over my presentation and give me any advice. This is my email. If you want any of this information, I'd be glad to share it with you. Note that my email is kyle.pierce@lsus.edu. That's not ISUS. That's LSUS. And I'll be glad to share this information or anything I have with you. I don't have all the answers. I don't claim to, but I'm always willing to try to find out and search out information that you may need. Thank you very much.
Thank you, Dr. Kyle. Okay, good, excellent information on nutrition and also the fact on different diets. I'd like to, at the end, you mentioned actually the fasting and of course for religious purposes for Ramadan, and just for information that, for example, in the executive board, so for example, I know that we have discussed the fact that world championship timing should be looked at so that fasting, it does not affect that. So we do, even at the organizational level, take these things into consideration. So now I want to ask you a question about coaching Kendrick, who was a vegan, and so he was an adult when he was eating a vegan diet compared to, for example, if he would have been a young athlete and training. So can you tell us what kind of special things did you have to discuss with him during the training, or to make sure that, for example, it was the energy and getting all the proteins? What kind of discussions went between you two?
I mean, we were always talking, about, how do you feel today, and how are you doing today, and things like that. So we always did that in general. So there wasn't anything really I felt that was different, in those regards. We just had a lot of the same conversations that we had prior to that.
Okay. Do you know if he kept a diary about what he ate, or because planning was the very important fact in this, whichever, I mean, planning your training, but then also planning the eating. Do you know if he's aware if he has a diary himself?
I'm not sure if we had a diary, but we had one of our athletes' father was a dietitian. I know he worked with several of the athletes here, and we've had dietitians. I've had good response from dietitians in the community, and I know other people may not have that, but I always encourage coaches to, try to seek out the dietitians. A lot of them at the hospitals will do it for community service, or they like sports. They're interested in sports. They want to get involved in sport. They may not be familiar with the sport of weightlifting, and that's where you may need to educate them. But I think as much as possible, seek out a dietitian. Just like, you want to seek out a sports psychologist and biomechanist. You want to seek out all those sports science. Try to develop your own team. You don't have one already of those experts.
Yes.
Yeah.
Okay. Yeah. Good, because that was the important thing that you stressed, that any diet, whatever it is, even changing diets, it could just be that the diet before wasn't good. So any change in it would actually be a change for better. So,
Yeah.
So planning is important.
Yeah, just like planning training, planning, recovery, planning, your whole lifestyle, plan long-term plans, planning the quad, So the diet should just be part of that, integrated into that.
Okay. We've had some questions, but they've been mainly technical questions, and I have answered those on the side there. But we don't seem to have any questions for our presenters. So if you go back to the, we do have one. So do vegans need to increase their number of eating to get the calories they need? So Dr. Kyle, can you answer that question? And especially in Kendrick's case, for example, did he need to increase his intake?
He did mention that he ate a lot. He could, and that he could eat a lot. He didn't have to worry about his weight. He could eat as much as he wanted there. That's the way he sort of put it to me.
Okay, good. See if that generated some other questions. No, it did not at this point. Okay, so please contact the presenters directly, and you can review this again on the IWF YouTube site. And I would like to thank everyone, as evening is coming in Europe, and we have daytime in Pan America time, and Asia is waking up to a Tuesday, and we will be excitedly coming to visit Dr. Junichi in Tokyo for the Olympic Games. Okay, bye-bye everyone. We're logging off. Happy weightlifting.
Bye-bye.